Hi everyone. Today I'll be presenting my signature assignment. My topic is Informatics Supported Diabetes Education Intervention for low-income older adults in Riverside County, California. The purpose of this presentation is to briefly explain the health problem, the vulnerable population, and the intervention I propose. My focus is on older adults age 60 and older in Riverside County who have diabetes, prediabetes, or risk factor for diabetes. This topic is important because diabetes is not only a diagnosis, it is something patients have to manage every day through the food choices, activities, and medication, blood sugar monitoring, and follow up care. For adults with limited income or transportation problem, this can become even more difficult. This slide shows that diabetes is a major health issue at the nation and state level. Older adults are one of the most affected group. These numbers shows why education and prevention are important, especially for people who may already have barriers to care. In Riverside County, diabetes also an important chronic disease concern. Community-based education can help reach older adults who may not attend regular clinical classes. Places like the churches, senior center, pharmacies, and health fair can make the education easier to access. The main problem is that the low-income older adults in Riverside County are at the high risk for poor diabetes outcome. This is often related to limited diabetes education, healthier food access, transportation, glucose monitoring, preventive care, and follow-up services. For the need analysis, I reviewed data from the national, state, and local public health sources. I also look at the evidence about the diabetes self-management education and consider the needs commonly seen in community outreach and screening setting. The key finding shows that this population needs more than just a basic screening. They also need simple education, referral support, follow up, and help understanding how daily habits affect diabetes. Screening is helpful, but is stronger when it leads to education and follow up care. The target audience is low income adults aged 60 and older in Riverside County. The best learning environment would be familiar setting such as a church, a senior center, pharmacy outreach event, or health fair. These settings feel more comfortable and may easier for adults, like older adults, to attend. Informatics helps make the intervention more organized and data driven. Nurses can use public health data to identify the problem, screening log to track risk, pre and post teaching question to measure learning, and referral tracking to see if participants are connected to sources. For this project, I proposed a short community diabetes education session. The goal is to keep teaching simple, useful, and realistic for older adults. The session would include a handout, blood glucose screening education, referral resources, and basic follow-up tracking. This intervention makes sense because diabetes requires daily self-management. Patient needs to understand how nutrition, activities, medication, glucose check, food care, and follow-up appointments affect their health. Education can help older adults feel more confidence and prevent complications. The goals are measurable. By end of this session, most participants should be able to name three diabetes self-management behaviors and identify at least one follow-up resource. The scope focus on low-income older adults in Riverside County who have diabetes, prediabetes, or risk factor. This slide shows how the intervention could be elevated. The ladder ends means the number of the participant. We would track how many people were reached, whether knowledge improved, how many referrals were made, and whether follow-up was completed after 2 weeks. Okay, this is my references slide, and this is the end of my presentation. Thank you for listening. On the next slides, I will answer a few questions related to my presentation. So I have here a question from Kyle, David, and Christina related to my presentation, and I will answer them one by one in order. The first question is do you think language barrier could affect diabetes education for older adults? My answer is gonna be yes, and it's definitely like if the education is not like in the person language who's like understanding that language, they might missing a lot of information, I think, and that is like why like simple word and visual and translated handout can like very helpful for them. And for second question, they asked me like, why did you focus on Riverside County instead of just talking about like diabetes in general? So like I focus on Riverside County because population health should be connected to a real community, and looking at the local data helps makes the project more specific and more useful for the people living in that area, I'm sure. And for a last question, they ask me, what is the one thing nurse can do right away to help this population? I think one simple thing nurses can do is provide the clear teaching and connect patients to resources, even like a short conversation about like food choices, medications, like glucose checks or follow-up care can make different. So, and I hope like answer all these questions well, and thank you so much for listening to my all presentation. And that was like ending of the question and answer. Thank you.